The challenges for Saudi Arabia they are a bit different than in Western countries. The challenge varies to screening, which is namely social culture more than others, and this is because of the type of culture that we deal with here in Saudi Arabia. It is a conservative community, and it is not easy to talk about something delicate and sensitive issue like breast cancer in our culture. Females usually don't feel comfortable to talk about cancer in general and this cancer in particular. In Saudi Arabia, in the area of integrating the medical care, we don't have that measured problem in this area because Saudi Arabia, of all of the regions, has medical clinics and hospitals. The second thing is that we have the best qualified doctors, so in this medical part, we don't have a problem. The main problem is in the awareness and the knowledge, the education and the empowerment of women knowledge. This is the area that we lack, and this is why people they need to be empowered with information so that they could utilize the resources. There is definitely underutilization of the available services. The problem as well is that the women here, because of the lack of enough knowledge and too little knowledge sometimes, when we empower them with knowledge. They have a lot of misconceptions and myths about breast cancer. I keep saying that breast exam is the best power because it encourages women. It gives them knowledge that people do survive breast cancer if detected early enough. In regard to the advancement and the changes, we feel there is definite change in the beliefs of the people and in the women living among the women and the families in general. We didn't achieve yet what we want to have, like the same level like in Western countries. But if you compare the knowledge and awareness and acceptance of mammography and all the screening tools now, if you compare to it 3 or 4 years back, definitely there is a major change. Cultural beliefs take time to change. In October, for example, there was a lot of campaigns almost everywhere in Saudi Arabia, in the north, in the south, in the west, and east. So this is something we didn't get used to do before. So definitely there is a change and an increase in awareness, but we still need to do a lot about this. You don't expect to change or to make a change within a year or two. Sometimes it takes more than this, and I'll always say it might be difficult to change, but let's work on the young generation. They are the ones who are going to carry the message after that. And in the public, in the community, my focus is on the schools and even the little girls. I'll give you an example. 2 or 3 weeks back, I went to one of the schools and we gave a talk and it was targeting the girls from the age of 8 to around 13 or 14 years old. And people were surprised because it wasn't easy, even for some of the schools, to accept that we go and talk about breast cancer to this age group. We know that these are little girls. They are not the group whom are supposed to have breast self-examination or whatever. To me, I take it from a different angle, and I feel that this is the group that I should focus on, because they are like ambassadors. They could carry the message to their families, to their mothers. They could have a better impact on their own families and others, and this is what is happening now. I remember the next day my medical student, she came to me and asked me, "Were you at this school yesterday?" I said, "Yes." "How did you know?" She said, "My little sister, she was among the group that you met." She went home telling her mother that Dr. Amoudi came to the school and told that you'd have to do an examination for this. And she was even trying to examine the breast of her mother. These little girls, they are ambassadors. To take a message home, they could influence their families. I always focus on religious leaders and the religious aspect because there is a lot of misconception as well. Culture-wise and misbeliefs of certain group of women and even men, they have misconception about certain things in Islam, and religious people could have a great impact. They could influence the people and make a real change of well-being and attitudes. I'll give you an example. People think that men aren't allowed to examine women under any circumstances, which is not true in Islam. In Islam, there is no problem if the female goes to a male doctor exposing the breast for him to examine the breast, provided that there is no qualified male doctor, and it depends on the case as well. So there is no problem even from the aspect that women, they could do a mammography, even if they have to go to a male doctor. This is the kind of misconception that you are trying to change, and these are the situations that you are working on so that people's perceptions will change and they will know what is right and what is wrong about it in Islam. The role and the attitudes of the religious leaders is varied. Like everything in the world, they vary in their perception and attitudes, and the same things among the religious leaders. In Islam, your body is very valuable. Moderates do understand the real rules of Islam, and they're great advocates and great support to us. We are responsible in front of God to look and take care of our health. So a lot of religious leaders are really great advocates, and they do encourage women to go for early screening, and they show them or explain to them what is true rules about having male doctors examine them. You see in life, sometimes you have surprises, and you face challenges yourself that you have never thought you would face one day. If somebody had told me or asked me maybe 10 years back what you are going to do if one day you face this problem or breast cancer, maybe my answer would be different. But when you find yourself in this situation, I don't know how to explain it. But when I felt the mess and I found that being a doctor, I could say that I was lucky or unlucky. I was lucky in a way because I'm a doctor, so I know at once most probably that this is a breast cancer. I was unlucky because I didn't have enough time to absorb the shock of having a lump in my breast. But I don't know immediately the first thing that came to my mind that it's like a message from God. It's meant to be for a good reason. Maybe being a doctor, because I have education even before I got breast cancer, maybe because it was to deliver this message to other women so that no other woman will suffer and have the agony that I had. I never thought of any of the things that I am doing right now. It came suddenly. One day I found myself diagnosed with breast cancer. The next day I was in the operating room, and you see things were going very rapidly. And one day I found myself a member in the partnership, United States Middle East Partnership, and I started a journey I never thought about before. I was diagnosed in April 2006. In June, 2 months later, the same year 2006, the United States Middle East Partnership was announced by the former First Lady. I don't know this is coincidence. Sometimes I believe as well it's meant to be for a good reason. Why the partnership is happening at that time? Just 2 months after I was diagnosed, I felt that it was like a wake-up call, as we say, and it gave me the strength and the support and the push so that I understand more and more about breast cancer. And this partnership, to be honest, and the experience with Susan G. Komen for the cure, from the involvement with Komen Foundation, it gives me a lot of experience. It gives me a lot of empowerment. And I think this is what helps me to go more and more looking for openings. The other thing is using the media, because I think that one of the things which I believe, those great steps in achieving what I have achieved is my belief in the media. I always believe that media is the strongest tool for outreach, and I believe in media in large extent. For the global initiative, particularly the Middle East Partnership Initiative, I think that first of all what has been achieved through our connection and the experience that we have gained from networking with all these, with the Breast Global Health Initiative and with Susan G. Komen, it was, to be honest, if it wasn't for this networking, things wouldn't have moved that fast in our region. We do have the facilities, we do have the resources, but we lack the experience that these big people and the keynote figures like Ambassador Nancy and like Officer Ben Anderson of the Breast Global Health Initiative. The work we are doing is amazing, and I always feel like they are real role models that we love to follow, and we love to achieve the things that they have achieved in the United States. So it did help in pushing things and reaching what we have achieved so far. I have learned that breast cancer means basic management. It is a big concept. There is a lot of issues that they are forming again in the medical services and again in the medical care in Saudi Arabia. This is what we are trying to provide in our Center of Excellency, like patient navigation, the counseling clinic, the survivorship clinic with psychosocial support, all these aspects which were until recently not available, and we didn't have this concept of breast cancer care in our region. As a survivor and as a physician and an advocate, besides being the CEO of Sheikh Mohammed Hussein Al-Amoudi Center of Excellence in Breast Cancer at the King Abdulaziz University, Jeddah, Saudi Arabia, we are working hard to achieve the vision and the mission that we are looking to be nationally and internationally amongst the leading centers of excellency that are up to the standards of the international standards of centers of excellency internationally. And we hope that through agreed need, our services, and through introducing the new concept of medical care, like the other centers of excellency in the Western countries, we hope that we could achieve our mission and be recognized internationally and be among the world-class centers. So we hope that we could reach everybody, every woman in this globe. We hope for a world free of cancer, of breast cancer in particular. I always say, maybe I couldn't help myself, but I'm trying my best to help my daughter and every daughter in my country and in the whole world.